Now, how do we know that whether a person is having uh, a good DNA index or not? So when it comes to infertility treatment, in case if there is a repeated miscarriages or if our embryo quality is not good, so there is one test where with respect to the male parameter we can able to find out, that is the sperm parameter. But when it comes to the female parameter, that is on the oocyte, there is till now there is no test which will say that out of this 10 oocyte which we collected, this has a very good DNA and this don't have a average DNA or this don't have a good DNA at all. But when it comes to sperm, we can do certain tests called DNA fragmentation index. In this, we can able to assess what is the percentage of DNA damage the male semen is considered. So this test is called STS method, that is sperm chromatin decondensation method. So here you can see three pictures. The sperms are subjected with respect to series of steps, which we call it the standard protocol for DFI. Each steps are mandatory and make sure that we follow a proper steps in it. Once we do it, at end of the procedure, we get this kind of appearance in our microscope, where you have see, you can see on the left hand side, you can see there is a sperm tail, but on the head there is a big halo, which called as halo. And on the middle, you have a sperm here, but the halos are moderate, not that much. On the extreme right, you can see there is a sperm with no halo. So what does it indicate? The sperm which has a very big halo, which means they had HAD, had a very good DNA. Because of the procedure, what we are doing is we are making the genetic content to come outside from the sperm. So when it comes outside, in case if the halos are very good, which is nothing but when we lyse the sperm cell, obviously the DNA contents will spread out. And this is stained. Because of the staining, you can see a big halo, which means more the halo, that means the DNA of the sperm would have been much good. That's the reason there is a big halo. That means this left-hand side sperm cells which you are seeing, they had a very good DNA content in it. That is the reason it has a very big halo around them, which is nothing but the chromatids. That is the DNA. And the middle one, which had an average DNA, that's the reason the chromatin fibers are very less around the cell. And on the right hand side, there is no DNA in it, hence there is no halo. Because if there is a DNA, only then you can find a halo in it, right? That's the main principle of DFI. Since there is no halo in it, so no halos in it, no DNA in it, so that's the reason there is no halo in this form. Okay, so this is the test where we can predict what is the DFI. Now, how do you incorporate this into your day-to-day procedure? Say, for example, a couple has come and they say they have an history of multiple IVF failure. So first thing which we can do it from our hand is to make sure that we inject the best sperm. To inject the best sperm, we have to know whether the sperm quality is good or not. The quality in the sense, the DNA content. But apart from your morphology and the regular microscopic and macroscopic analysis, the DNA of the sperm is also very important. So we should know what is the DNA index, which says that when I choose, if the DNA index is very high, that means the chance of taking bad sperm is very high. Say, for example, I'll make you understand. Now we have, say, for example, there are 10 oocytes. You have to choose 10 sperm. If the DNA fragmentation is very high, when you choose 10 sperm, the chance of taking defected DNA sperm is very high because the index is very high. If it is very low, that means if the DNA fragmentation in overall sperm is very less, again, when you take 10 sperm, the chance of taking defected sperm is also very less. So this indicates in sperm DFI, so that is sperm fragmentation index, will say us in case if the index level is very low, that means we can make sure that we can go for a regular ICSI procedure. In case if the DNA index, fragmentation index is very high in this particular patient, these patients are recommended for a PIXI procedure or a MAC procedure, where we can get a good DNA. Okay, so this technology will make embryologists to understand and decide whether normal ICSI is okay for this particular gentleman who collected the sample, or he needs special procedures, special sperm selection procedures like MAC or a PIXI procedure to make sure that the sperm parameter is fine. That is, 50% of the genetic is fine. The rest 50% is the oocyte. Okay, that we'll discuss further. Okay. Now coming to the oocyte, again, how we look into the morphology of the sperm. Here, the oocyte morphokinetic is also very important. On the top, figure 1A and 1B, this is an ideal oocyte, which will range from 150, 100 to 170, 75 micron is the standard size of the oocyte. So when we do, when we handle the oocyte in our embryology lab, the oocyte size will be 150 to 175 micron. So this is an ideal oocyte. I'll tell you what are the parameters which we have to look into when it comes to an ideal oocyte. You observe this diagram carefully. Okay, let me take this picture on the right hand side. So you have a zona pellucida and the oocyte, that is ooplasm, and it has a polar body in it. So these are the three important things: the zona, the ooplasm, and the polar body. Apart from that, you have a perivital space, 4 parameters. Now, let us understand what is that good ideal oocyte. Now, here, if you see the zona is very light in color, and it is not very rigid. Rigid, you can't feel it here until you poke that when you do an ICSI procedure. But usually, the zona should not be rigid. Okay, it will be very flexible, and the space between the ooplasm, that is oolemma, and the zona, which we call it as perivital space, should not be bigger. Okay, the second important thing. The third important thing is you can see a polar body here. The polar body should not have any fragmentation. It should be like a single dot. There should not be any fragmentation. Anything which falls apart from this normal category will be considered that as an abnormal oocyte. So when we categorize them based on the morphology, you have a dysmorphic oocyte. The name itself says that dysmorphic. You can see the morphology is completely gone. It's not like clear round shape, either this oocyte or this oocyte. So this is morphologically defective. Some you have a polar body defected, where the polar body itself like fragmented. It has a multiple polar body in it. And there is one more called after fusion of the egg and sperm, you have a dysmorphic zygote. You can see the zygote is completely dysmorphic. And the polar body with defect, which I was saying, right? The top bottom picture you can see there is a polar. You compare the difference of the picture which is above and the below. This is an ideal polar body. But here you can see the polar body size is very big. So these and all, see all this morphologically defected oocyte and the polar body defected oocyte, generally they have a genetical abnormalities. And one more important thing is, let me come back to this later. One more important thing is when you start your embryology work, now how do you know that you select most genetically stable zygote? I'll tell you the tips. The only way we can select genetically stable embryo is our embryo biopsy procedure that we'll discuss later. But there is one simple procedure in our lab itself where to a certain extent we can make sure that we can avoid selecting the genetically unstable embryo. Now, what is the technique? We know how do we do an ICSI procedure. I don't know how many of you are aware that how an ICSI procedure is done. We just take an oocyte, a good oocyte, we inject the sperm. Say, for example, the oocyte is normal, where you can see an ideal oocyte here, right? So the same, the oocyte, to this oocyte, morphologically good. Say, for example, even with the PIXI procedure, I have selected a good sperm. I have injected this. Now, what we do is post-injection, 16 to 18 hours, we have to check the fertilization. the oocyte, whether this ICSI procedure resulted this particular oocyte into fertilization or not. When you do a fertilization check, remember these points. How do you assist a fertilization is when there is two polar body, one is when there is two polar body, one is from the maternal side, one is from the paternal side, which says that the oocytes are fertilized. Second thing is that simultaneously you should have two pronucleus. So one nucleus from the paternal and one nucleus from the maternal. So generally, what happens is when you fertilize the oocyte will have two polar body and two pronucleus. So both one set is from polar body and pronucleus is from the paternal and one from the maternal. So now this is an ideal fertilization where we can say that okay, fertilization went on fine. There's no genetical abnormalities. Anything apart from this, now what is that apart is two polar body, one pronucleus is a genetically unstable embryo. Okay, it has some chromosomal abnormalities. Or two pronucleus, one polar body, again this is an abnormal embryo. Or one polar body, one pronucleus, again it's an abnormal embryo. Or two polar body, one pronucleus, again this is an abnormal embryo. So anything which is apart from two polar body and two pronucleus, you can consider that as genetically abnormal embryo that you can keep as a second category of embryo for your embryo transfer. Okay, in case if you don't have any good embryo, this is high chance that it could be a genetically unstable embryo. That is your second option. That should be a second option. In case if there is no option left over for you, which means if you don't get any good embryos with respect to two polar body and two pronucleus embryo, this you can inform the patient that I feel that there is some genetical abnormalities in this embryo. Let us have an embryo biopsy and clarify that whether these embryos have a genetical abnormalities or not. Okay. Now coming to the other parameters like the giant oocyte. So what is giant oocyte is when you have a group of oocyte, I told you that the size of the oocyte will be 150 to 175 micron. But anything which is apart, say in this case it is 200. You can see even 300 micron sized oocyte. So these are all the abnormal oocyte. Generally, they will be an aneuploid embryo. Aneuploid embryo is nothing but genetically unstable embryo. Sometimes you have an SCR, that is a smooth endoplasmic reticulum. In this picture, you can see there is a big vacuole present in this. So when there is a big vacuole, it's nothing but SCR, smooth endoplasmic reticulum. Again, this has certain printing disorders in the DNA. Again, basically some issues in the chromosomal pattern. Okay, and post-mature oocyte. I told you, right? Apoptosis. Any cells, even the oocyte, right? At some point in time, they have to die. When we stimulate a patient, it doesn't go like very synchronized manner. That is, from day 2, all the follicles will equally divide, and then by mid-cycle, they will be equal in number. No, there will be unsynchronous growth. Some will be 17 mm, some will be 18 mm, some will be 22, some will be 26 mm size when we do a scan. So since it is an asynchronous growth, there are some oocyte which might be post-mature. Say, for example, there are 10 oocyte. All 10 oocyte will not go in a same synchronized manner in their dimension, in their measurement. So what happens here is some will be like post-mature. That means when they are about to die, when they are experiencing its apoptic stage, so we will be retrieved. So on this left-hand side, you can see they are all almost apoptic oocyte. On the bottom side, they are the newly formed, like fresh oocyte, or maybe there might be in a half-life period. But these oocytes are about to die. When they are about to die, they show certain features where you can see the the inner ooplasm will be very much dark, and they'll be very fragile. As soon as you touch them, they will lyse. So these are the indication that they are experiencing its apoptic stage. Okay, so you should never choose this apoptic embryo for your consideration, because this will again have a lot of genetical abnormalities.